In this lecture, we'll be taking a closer look at forensic taphonomy, specifically focusing on pathology and trauma assessment as it relates to the work of forensic anthropologists. It's important to remember that when we're thinking about, kind of the goals of investigation, with regard to the contributions of the medical legal system, it's important to understand that there is a primary focus on determining cause and manner of death. That's really our contribution to the process as a forensic anthropologist. The responsibility of certifying death, of course, is connected to the work of pathologists and medically trained professionals. However, the role of the forensic anthropologist is to assist in the identification, documentation, and categorization of evidence that might contribute or help in some way, shape, or form to professionals within the legal system. Now, in order to do this, one of the things that has to be learned is the language of the science, understanding how people communicate in a rather rapid form, the nature of pathologies that they are recognizing and identifying in human remains, and of course, the presence and degree of trauma, which we've looked at in previous lecture material. Now, there is a particular kind of legal terminology that is applied to medical legal issues as it relates to the work of anthropologists who are contributing to the development of casework and producing reports. Terminologica Anatomica is a important resource for understanding the nature of clinical terms and common names that are used in report writing. There are other resources published before 1998. However, Terminologica Anatomica provides the greatest number of commonly used clinical terms and resources. Now, the terms themselves are built or derived from two important resources. Very often, the terms will include the constructs that are taken directly from Terminologica Anatomica, and then very often they will incorporate the surname of the discoverer. Let me give you a basic formula for at least that first portion of word construction, or the construction of some of these labels. So the first word usually describes some sort of fundamental component. If you took a look at os cuneiform intermedium, which I have listed here in this slide for you, the expression os is Latin for bone. Now, the expression cuneiform then is, if we take it just from the Latin, means, if it's considered to be a noun, something that is a wedge. So if you're wedging open a door using a piece of wood, cuneiform would be a term that you could apply to that. An adjective like wedge-like, if you're describing an object, for cuneiform, again, that would be, wedge-like. We do have a cuneiform bone, but we find that in the foot. This is associated with the first digit. It's one of the tarsal bones, in this case, of the foot, just posterior to the metatarsals of that kind of, or the metatarsal of that first digit, again, medial side of the foot. That's the cuneiform bone. However, this expression is not necessarily applied to that bone. It is applied to a similar location in the wrist. And this intermedium is what gives us that additional detail. Intermedium is, again, between. So in this case, it can be a term that can be expressed, of course, or applied to bones of the wrist, bones of the ankle, again, just in this case, ventral to the kind of ankle joint, but it is more commonly associated with a radiating fracture pattern in the distal end of the radius. And what happens is, generally, this is the result of some sort of falling injury where you're trying to catch yourself, or you're catching the majority of the weight of your body. So that gives us an example of, in this case, a description that is associated not as much with the individual that initially discovered this kind of fracture pattern, but it is more associated with, in this case, a anatomical description of the location of where this fracture pattern generally will occur. Another more common way of identifying a pathogen or some sort of bone-related trauma, and again incorporating that into a report or some casework associated with a crime or some sort of criminal prosecution, is to use a common name. So common names generally are going to be expressions used by the general public or familiar to the general public as well as clinicians. And the use of these common names is uh, important when we have situations where an individual is an expert witness and they're being brought in for testimony. So I would say if you were to kind of look at the breadth of case reports over the last 10 to 20 years, you would see common names being more frequently utilized, or you will see a common name within some sort of associated clinical name or clinical term that's in parentheses or something like that. But the common names seem to be more commonly used just because they communicate to a wider audience. Let's start looking at these two major categories, but we'll start with pathologies and how they are understood and how they are described in the work of forensic taphonomists and, of course, forensic anthropologists. So etiology, what is this expression? This is associated with the cause or source of some sort of pathology. Etiology is also something that is applied to the science of studying disease, and in this case, how those diseases operate within human anatomy or within human physiology. Pathological conditions are generally categorized based on how they behave in the body and how they are initially understood, so their point of origin. So a congenital condition, for example, is something that is inherited. It's something that exists at birth. They're in a sense hereditary, whereas things that are considered to be acquired conditions are not inherited. They're developing as the result of some sort of exogenous or external or environmental factor or effect. So if you think about recent history, COVID-19, this virus that is or is contributing to, in a sense, a global pandemic, this is an acquired pathology. This is an acquired disease. It is not something that is congenital or inherited. If you think about a developmental defect in a bone field, spinal bifida, for example, that is something that is congenital, meaning it is inherited. It is passed down from mother to or father to child. Now, when we're talking about the work of forensic anthropologists, generally we are going to look at things in terms of normality or abnormality. We'll also want to determine whether or not something is contributing to a cause of death. So when we're starting to talk about different kinds of pathologies, we place them into either a pathological category or we consider them to be some sort of physiological anomaly. So an anomaly is anything that is out of the norm. It does not always have to be contributing to death or some sort of major quality of life issue that leads to death, but it's something that is unique maybe to an individual or to a group if it's inherited. And ultimately it is telling us something about the identity of that person. So we're able to, let's say, take a look at a radiograph of someone's arm. We have a healed bone lesion. That is an anomaly. That is something that helps us to be able to identify if we are recovering that bone from a crime scene or some sort of burial site, and we want to pair that bone with its source, in this case the individual who it originally was a part of, versus a pathology, which is something that is, again, it's not normal. It's a derivation from the norm that will lead to some sort of restriction in physiological function, or it will compromise one's quality of life or their life in general. So it can lead to death. So a disease like syphilis would be a kind of pathology. It would be a pathogen, just because it is something that will significantly impact one's quality of life or one's ability to persist to an older age. And so again, this represents a pathology, just because it's directly relatable to the functioning of the physiology of an individual. And the functionality can happen on a cellular level, or the break in functionality. It can happen on the level of tissue. It can occur on the level of muscle, organ, you name it. So there's all these different scales to the pathology as well, and how we understand it. Some general concepts then that we can start to tie to pathologies and pathogens. Things that are considered to be chronic, for example, chronic conditions are ongoing or persistent pathological states. The individual is not necessarily able to be cured of a particular kind of condition, but maybe that condition can be managed. So something like asthma or diabetes would be a kind of chronic condition that an individual is dealing with on a pathological level. Persistent back pain, maybe due to some sort of injury. These intervertebral discs can break down. They can also slip or move out of alignment. The vertebrae, the body of the vertebrae, the centrum itself, can also be, in a sense, damaged or fractured, and that can result in persistent pain or chronic pain throughout an individual's life. We can juxtapose that with acute. Acute conditions represent either a limited or single episode of a pathology. The individual might recover or return to a normal state, or in many cases, if it's dealing with a forensic topic, the individual may die. Examples of an acute condition could be, let's say, a gunshot wound, a heart attack, some sort of severe fracture from a fall. Again, it's something that is associated with an acute episode versus something that is a chronic condition. And the acute will very often have more of these anomalies than pathologies being expressed, especially if it's associated with some sort of violent act. If, however, an individual was receiving some sort of treatment and they were misdiagnosed, or they were prescribed the wrong medication and it resulted in their death, this would be considered to be an acute condition as it related to the death event. Let's take a closer look now at some other terms that are associated with how we, in a sense, organize the data that we're collecting as we're kind of trying to understand the causality of something, initially categorizing whatever that condition is. Now we're going to further classify it or categorize it as it relates to, whether it's a disease, a disorder, or a syndrome. So diseases are pathological conditions that are characterized by different kinds of criteria. There may be, for example, an etiological agent at work. There can be some sort of anatomical alteration, or you can have signs or symptoms that are associated with a disease, and that's how we are looking at them, either in hindsight or in the current moment. So if you look at something like diabetes or cancer, we'll look at diabetes for a moment. Of course, there are a variety of expressions of diabetes, but generally we understand diabetes to be best known through blood tests. So the idea of an individual maybe fasting and then having blood drawn, then we take a look at, like with an A1C kind of blood test, we take a look at the presence or absence of, or levels rather, of blood sugar. There are, in this case, glycated hemoglobin tests that also help individuals to diagnose the presence of that condition. Um, and generally, we're looking at, or the physician is looking at, glucose levels and whether they are being expressed within kind of an average or a tolerant range of expression within the bloodstream. Of course, you have to know what a person's eating prior to when the blood is being drawn and things like that. So that's why generally there is some sort of fasting that occurs to get a baseline level for that. So that is going to be something that is going to start to tell us about whether or not we are dealing with diabetes, or let's say type 2 diabetes, and that would be falling into that kind of symptomology. So we would recognize that condition by signs and symptoms. Signs and symptoms can also be incorporated with, you know, information on the individual's lifestyle, the do's and don'ts, things like that. You can also look at, in this case, um, you know, alterations to the anatomy. Is the individual starting to take on a great deal of body fat, let's say in kind of the waistline area, and are they starting to have issues with regard to things like blurred vision, the frequency with which they are urinating on a daily basis, fatigue levels, things like that. So, does the person feel worn out? Or if they are cut or have an abrasion, what is the healing factors associated with that? Or is there a situation where, this is generally something that is abnormal, or an abnormality with regard to healing uh, rates, hunger levels, as I said, weight gain, weight loss, all these different kinds of kind of physiological characteristics that are associated with alterations to the body and to behavior as well. Now, when you're talking about type 2 diabetes, a tendency toward expressing this kind of condition is something that can be inherited. So there are inherited qualities to it, but then there are also environmental qualities to this as well. So there are exogenic processes at work that can also contribute to the development of type 2 diabetes for an individual. It can be, let's say, a lifetime poor lifetime eating habits, or it can be associated with a lack of exercise or a combination of a variety of things. What we're finding out, though, more and more rather, is that it is considered to be more of a congenital. There's a stronger congenital piece to how we recognize type 2 diabetes. So again, just an example of, in this case, a disease or a pathological condition, and how it fits particular kinds of criteria as we're describing it or identifying it for some casework. Disorders, these are disturbances as they relate to human physiology, so the function or the structure of an aspect of our anatomy. Um, a disorder might be genetic. It could be something that is, again, congenital in nature. It can also be the result of exogenic factors. So if a person has been poisoned or they have been exposed to some sort of environmental toxin, that could lead to some sort of disorder. It could be associated with an injury, a poorly healed injury, and sometimes a disease. In terms of a common disorder or a disorder that we are aware of, or many of us are aware of, anorexia nervosa is an eating disorder. So this is a disorder that can be connected with different kinds of behavioral and psychological traits. Sometimes it was referred to as an emotional disorder. So how a individual is perceiving themselves, and then how they are acting on that. And things like being obsessed with weight loss is it's an associated symptom with anorexia or anorexia nervosa. Um, when people are describing their body, or if a person is asked to describe, what kind of body type do you have, they may, in a sense, experience fear or distress in their response, or they might, in some way, shape, or form, describe themselves in a way that is not necessarily accurate to how the majority of people would describe them. So if you or I are looking at Tom, and Tom is describing himself as inherently obese, but he is as thin as a rail, that kind of expression. And then this is something that is recognized as a medical disorder, and then it is something that is actively addressed through therapy. And a lot of that therapy is psychological in nature. So the majority of it. So that would represent a kind of disorder. And then we have syndromes. Now, a syndrome is, in a sense, a collection of signs associated with some sort of morbid process, meaning it is something that is associated with an abnormal or an unhealthy kind of behavior or physiological expression. A battered wife syndrome or carpal tunnel syndrome. These are examples of conditions that are, in a sense, morbid processes or conditions that are abnormal or deviant in some way, whether they are behavioral or they are anatomical or physiological. So carpal tunnel is associated with habitual movements of the hand. And ultimately what is happening is there's an overstimulation and ultimately a compression of a medial or median nerve in the wrist that is, again, the result of this kind of constant usage, typing, very small, finite movements that require a significant amount of dexterity. And what is this syndrome? How is it identified? A person is experiencing quite a bit of pain, let's say, or sometimes numbness associated with the wrist or the hand. The numbness may extend up into the kind of the palm of the hand. And again, this is, there could be also weakness in the hand or the arm itself. So these are characteristics that are symptoms of a particular kind of syndrome, such as carpal tunnel. And it results in a condition that is limiting to the individual. Limited movements, the experience of pain, so on and so forth. And that's what makes it or connects it to a morbid process as well. But in terms of the work of forensic professionals, understanding again the medical history of a victim or an individual that is, um, a victim of some sort of criminal act, understanding, their medical conditions is very, very important. Being able to determine how a medical condition may or may not connect to or contribute to a cause of death. Given all of that, our understanding of diseases is very, very important. And it is for that reason that taking a class or having some sort of background in human pathological studies or human pathologies and diseases, this can be very, very helpful for a variety of individuals working within the medical legal field. So again, a hallmark symptom is important to understanding a disease and identifying that disease. Having some sort of specific diagnosis that maybe is part of a file or is something that is or has been recorded is an important resource. And being able to determine or classify a disease, this is referred to as pathonomic. So using some sort of diagnosis in an individual's history to say, okay, this individual had type 1 diabetes or type 2 diabetes. This is a pathonomic process and allows the investigator to be able to kind of fill in that background history. Now, don't get me wrong, while general symptoms such as fever and nausea, an individual may be experiencing pain, they may be part of a larger series of symptoms that can be connected to a disease. Pathonomic features can also be applied to disorders. So if you take something that is seen in forensic circles quite a bit, having to do with the injury and the death of infants and the very young, this shaken baby syndrome, and the development of what are referred to as retinal folds. If you're seeing retinal folds, or in this case, tears or detachments in the lenses of the eye, this is a characteristic, a pathonomic characteristic of this syndrome. So the term pathonomic can be applied to both, but I'm using pathonomic with regard to how we specifically diagnose or classify a disease in this case. Sequela is another term that can be associated with what we're looking at here. These are kind of morbid conditions that are associated with some sort of medical um, condition or some sort of physical event. So let's say if we had an individual that had just undergone surgery, but they had, in this case, some sort of secondary infection that was the result of um, an error in the surgical process, that would be kind of part of this sequela or a morbid condition that tells us what just happened, or that in this case, the individual was sick or had passed away because of this secondary infection. Now we can tie it back to that surgical event. Or if you're dealing with a situation where maybe there was a fracture and the development of an embolism that resulted in the death of the individual, that would fit into, again, sequelae, this idea of something leading up to or a condition of an illness or a death event. You can see that one's ability to be able to assess a condition and how it connects to a disease, a syndrome, or disorder is very, very important. And it can be understood on an individual level, on a group level, or on a populational level. Now, when you're dealing with a disease such as COVID-19, which we're all kind of struggling with right now in 2020, this is something that is really occurring on a populational level. So a term in forensic circles like penetrance would be applied or would be used in relation to the symptomology and the overall projection and expression of the disease in a population over a specific amount of time. That's something that could be applied to something like COVID-19. So again, penetrance relates to that portion of a population with a specific kind of genotype, or let's say blood type, or particular kind of environmental or behavioral standard that or something common to that group that in a sense will express the characteristics of a disease in the phenotype. Um, for example, or another example, if you think about sickle cell disease, that is something that this term penetrance can be applied to. In this case, this is an inherited condition as opposed to something that was acquired exogenically. But the idea of a person that has a tendency toward disease can also be applied toward environmental kinds of conditions as well, or how they are being expressed within a population. So penetrance is another aspect of disease that can be incorporated into our analysis, but something that is on a much larger scale. Let's conclude our brief look at pathology with a brief discussion of 5 kind of traditional classes of pathology as they relate to the work of forensic specialists. So you have things that we've kind of touched upon, things like genetic disorders. Those are generally things that are identified and described. We have neoplasms. These are expressions of new growth or abnormal growth. There are systematic pathologies, generally pathologies that will be affecting in some way, shape, or form the function of a physiological system. This can very much lead to death. Environmental pathologies, maybe, as I said before, an exposure to some sort of environmental agent like a poison or something like that. And then infectious disease, things that, again, are related to an external exposure, but in this case, something that is considered to be or classified as an infectious agent. So these are the kinds of classes then that pathogens will be recognized and classified into and then described accordingly. And this is different than what we see with trauma. And in previous lecture material, we've talked about different kinds of trauma. I'll review some of that and add a few new ideas to it. But trauma is different from what we've seen with pathologies, disease, disorders, and syndromes. Now, when we're talking about trauma and trauma assessment as it relates to forensic taphonomy, as you know, trauma is considered to be a discontinuity in human tissue that results from a single event or a series of events. It is something that is not necessarily natural, but it is something that ultimately is, there's an environmental piece to it. There's an act, there's an injury, and potentially there is a death event. Initial descriptions of trauma will include a measure of physiological measurement, anatomical measurement, from vertex or syncipit. In this case, vertex or syncipit relates to the location of an injury as it relates to an anatomical landmark. Usually this is the midline of the body or the mid-sagittal plane. So we take a look at the remains and we identify trauma, skeletal or otherwise, and relate it to an anatomical landmark. Following this, any sort of lesion or unnatural pathological discontinuity associated with tissue is also recorded. A lesion is going to be a pathological or traumatic discontinuity. We will look also for defects. These are imperfections or maybe an absence of tissue development or some sort of failure of a physiological system in some way, shape, or form. And then, of course, we look for wounds, and a wound would be the more common traumatic defect. This would be a defect or lesion caused by some sort of weapon. And as we've talked before, we'll classify those weapons, we'll categorize those weapons, and even the trauma associated with those particular kinds of implements or objects. Trauma is something that is different from pathology in the sense that it is a primary cause for any sort of injury, and ultimately it can be a primary cause for the circumstances leading up to one's death. Now, there are different kinds of trauma. We've talked about blunt force trauma, we've talked about sharp force trauma. I'll just redress some of these in relation to this topic of forensic taphonomy, pathology, and trauma. So sharp force trauma, this includes different kinds of wounds associating with chopping actions, slashing, incision wounds, stabbing wounds. Generally, we're dealing with a wound that is inflicted by some sort of very sharp object, or an object that has some sort of linear and terminating blade expression. Abrasions are a type of result with regard to sharp force trauma. This can be a rubbing injury, a scraping injury, some sort of superficial laceration to the skin. It can be damage to a mucosal membrane. We have lacerations in general. These would be a complete severing of tissue, a commutation, for example, a split. They can, in a sense, express a greater type of force that is applied within the sharp force traumatic area. Generally, there is a pretty high degree of mechanical stress that is overcoming the overall strength of the tissue that the object is coming into contact with. And so that creates a complete dissection or split or tear in tissue, bone or otherwise, and that represents a laceration. And then we have incision injuries, and that's what we see pictured here, an incendiary wound to the proximal end of a femur. This incision represents a division of tissue, and generally it will be a division that is clean in nature. With regard to wound types, as I said before, when you're talking about sharp force trauma, chopping, stabbing, slashing, or incision injuries are things that commonly fall into this major category. A stabbing wound, it has a lot to do again with the physics behind how the wound develops, but a stabbing wound is associated with a thrusting action. It can result from an impaling force as well. Chopping wounds, these are produced by some sort of hatchet-like sharp force object. So a hatchet class of objects would generally create chopping wounds. And then when we initially identify these various kinds of expressions as they relate to sharp force trauma, we then start to document what we are seeing and of course photograph it as well. Now this picture here is a stab wound to the chest, or it's the result of a stab wound to the chest. This is the manubrium of the sternum. Again, when you think about chest injuries, it's very common that the thorax in some way, shape, or form will be impacted physically by this trauma event. In this case, we see a slash from right to left for the observer, left to right. In the case of the victim, in this case, a slash across the manubrium, and ultimately some of the associated fracture patterns that develop as part of that process. So if you were to look at this in much closer, if you were to zoom in on this photograph, you would see there would be additional radiating fractures in and around that deeply incised wound that we associate with that stabbing injury. There's also on the kind of base to the left-hand side of what you're seeing, again from your perspective, would be the right-hand side for the victim. There's also the development of a bone spur. It's a little hard to see, but that's another characteristic of this stabbing process and this sharp force expression. In terms of then documenting a stab wound, if we were to document this, we would take a look at the number of wounds associated with the entirety of the event. We would look and document look at and document the anatomical position and the orientation of the wound. We would want to get a sense of the shape to be able to categorize it or classify it, the length of the particular incision, the overall depth of the discontinuity, and then, of course, the direction and force. And then we take all of this into consideration with our observations. We incorporate peripheral kinds of evidences as well, including defects and things like clothing, or we might look at blood splatter. All of this is taken into consideration as we are recreating the traumatic event and trying to incorporate that into a larger case file for some sort of prosecutorial outcome. Other evidences that again are chiefly associated with sharp force traumatic events include stria or grooves, defects that are in and around the surface of the injury. We see another chopping injury here. to the frontal bone on the right side of the individual. We might look at how the blade behaves in a wound track environment, how it was oriented, where it was initially the kind of the center point of the force, where that existed anatomically, and then where we see any sort of termination in the traumatic division of tissue. And then, of course, we notate, or make notations rather, on the type of blade and how the blade progressed through that traumatic event and how it ultimately was part of a larger physical motion, like the stroke of the blade, where it was coming from the side of the victim, where the person was standing, maybe something to do with the height of the individual and the direction and strength of force. As we start to look more closely at injuries, and as we start to photograph some of these and connect them to external sources of evidence, we can also get a sense of the kind of object that's being used in the traumatic event or the series of events which led up to an injury or the death of an individual. Here we see an expression of something referred to as chattering. Chattering is or represents a series of abrasions or small lacerations that are associated with some sort of serrated edge. It's not fully creating a strong, deep laceration. Instead, it is creating a series of anomalies in skin tissue or bone tissue as it relates to the shape of the blade. And in this case, we have, as an example, a key that was used in this case, a violent act. So the edge of the key is producing the kinds of defects that we see and are associated with skin tissue. And again, it's this kind of, we can even get a sense of the series of events and the movement and the motions associated with this kind of trauma. And this would, of course, these kinds of tool mark analyses fall into that sharp force category. Some other examples for you to consider as well, again, all osteological in this case in nature. On the left-hand side, we see a typical kind of stab wound to the superior portion or the superior aspect of the eye orbit, in this case, the right eye orbit. We see this kind of left to right kind of slashing defect. And there is a spur that indicates, in this case, and the spur would appear kind of in the lower left-hand portion of the injury at the lateral side of that superior eye orbit region. That gives us a sense of, again, the extent and the manipulation, the force that's associated with the sharp force object, and it also speaks to the notion that this is not an accidental kind of event, but this is intentional. It's also not defensive or self-inflicted. This is something that was, again, an attack to the upper portion of the face and the head. To the right, we have another short force injury. This helps with blade direction when we start to examine this, the path of the weapon. The humerus in this case has been severed, but it's been severed post-mortem. There was a handheld blade that traveled from the kind of bottom left to the upper right, again indicated by where that arrow is superimposed on the photograph. It indicates the direction of the stria and some of the kerf associated with, how this bone was being severed, and kind of the sawing process and how people were, in this case, disarticulating the remains after the individual was murdered. And then last but not least, we have our blunt force trauma as another major category of traumatic expressions and events associated with injury and ultimately death. Again, this is a result from some sort of blunt object. There are abrasions and fracture patterns. There are lacerations that can also develop depending on the direction and the strength of the force that's incorporated with, in this case, the blunt force event. When we describe blunt force trauma, generally we will take a look again at the anatomical location of the fracture and fracture patterns. This is an upper humeral fracture. It's a tubular bone. This is a major injury to the diaphysis, but it again will approach the proximal end of the bone where it is articulating with and in the shoulder. This is associated with, in this case, a physical altercation and an injury where the blunt force event is coming up from the kind of center of the body, in this case in relation to the victim, and striking the victim just below the kind of armpit area and causing a complete break in the bone. Um, and so we look for and we analyze, the complexity of the fracture. We look for different kinds of biomechanical evidences, the development of these bone spurs and such, to be able to classify and categorize that trauma once again, placing it in a blunt force grouping, and then kind of recounting the particular kinds of physical events and physiological and physical characteristics that can be associated with what caused this kind of discontinuity, pretty extreme discontinuity in bone material and bone tissue.